Return demonstration on physical examination technique. The first thing that we will do is conduct general survey and review the interview note. We will also explain the procedure and position and drape the patient correctly. We will ensure that there is adequate light and explain the procedure to the patient and wash our hands. We will put the patient in sitting position and expose the body part to be examined and drape the patient appropriately. We'll compare findings of any side of body to the other and follow the IPPA sequence. For inspection, we will expose the body area to be examined sufficiently. We will inspect for color, odor, sounds, shapes, texture, size, location, movement, and symmetry. For palpation, we will inform our client to expect occasional discomfort. We will ask them to report pain, warm our hands, and keep our eyes on patient's face. We will cover the entire area to be assessed systematically, keep the tender areas last, and start with light palpation. With light palpation, we will hold the tips of 2 to 3 fingers together and press gently on the skin to a depth of 1 to 2 centimeters. We will use the dorsal part of hand to assess the temperature, and we will palpate for texture, swelling, pulsation, lumps, tenderness, temperature, moist, and elasticity. With deep palpation, we will instruct our patient to relax. Press down 4 to 5 centimeters with the fingertips of both hands. We will place one hand on top of the other if needed. With direct percussion, we will instruct our patient to tell which areas are painful during test. We will use 1 or 2 fingers and tap the finger pads directly on the body part. We will percuss for sound and tenderness. With indirect percussion, we will press and hyperextend the distal part and joint of middle finger of non-dominant hand firmly on the body part to be assessed. We will keep the rest of the non-dominant hand off the body surface. Bring the dominant hand wrist over the non-dominant hand wrist. We will flex the dominant hand wrist and place the dominant hand forearm close to surface to be percussed. We will use the tip of flexed middle finger of dominant hand to tap beneath the distal joint of the middle finger of non-dominant hand. We will do it perpendicularly, directly, and quickly. We will also lift the tip of middle finger of dominant hand rapidly between strikes and move the non-dominant hand to cover the entire area to be percussed. We will keep consistent degree of firmness exerted by the hyperextended finger while moving from area to area. We will listen for sounds like amplitude and quality. For auscultation, the first thing that we will do is disinfect the stethoscope. We will eliminate extraneous sounds and warm the stethoscope with our hand. We will slope the earpiece in ears facing towards nose. We will place the head of stethoscope on the body area to be assessed using the diaphragm. We will hold it firmly enough against the patient's skin to leave a slight ring afterward. Then we will place the head of the stethoscope on the body area to be assessed using the bell and hold it lightly against the skin enough to form a seal. We will listen and identify the sound's intensity, pitch, and duration. And that wraps up physical examination techniques.